Interprofessional education and interprofessional collaborative practice benefits our patients in so many ways. With a lot of the patients who would have a communication disability, maybe it's a hearing loss, maybe it is a speech problem, maybe it is a swallowing problem, that because our students are on those teams, the other professionals are learning how to communicate with those patients, which ultimately leads to better outcomes and better care and better compliance and greater satisfaction.
We're moving away from silos and getting more into this collaborative practice, which is so imperative to help with diagnosis and management decisions for our patients. I've participated with a nurse practitioner, and we actually have dizzy clinics where we saw multiple patients. It was a shared medical appointment. We saw multiple patients at one visit, and we each would perform an evaluation on these patients, and then we would come together to make decisions for the patients as far as next steps in management or particular testing or treatment. So that was kind of a unique experience of two collaborators, two providers with multiple patients, but really successful patient outcomes.
Working as a team holistically to improve the outcomes and essentially to ensure that they're satisfied with the amount of care that's being given to them from each team member. I think that is very beneficial for the client. Not only do they receive a skilled leader, but they also receive a skilled team player. Us being able to, sit our titles aside and understand that the most important thing is the client in that setting. And the most important outcome is for us to work together so that we can get to the treatment aspect of everything and make sure that they're treated to the best of our ability.
From the clinician's perspective, there's more job satisfaction for them. That no 2 days are the same, no two teams are the same. So the teams are going to change based on what the patient's needs are, because it is patient-centered care.
I would say for myself, it's been most satisfying to learn from other professionals, to have somebody, a colleague, a buddy who we're able to bounce off ideas. We're all trying to solve this puzzle of what could be causing patients to be experiencing dizziness, vertigo, imbalance, you name it. And to be able to have another provider to learn from, to help broaden my views of what could be the cause, it's been most beneficial.
My students have benefited in a number of ways. First of all, they have learned about the other professions. They've learned what their roles and responsibilities are. They've learned how to collaborate and work together as a team.
IPE expounds the knowledge of each professional. Not only are you leaving with more skills, you are also marketable. But seriously, you're able to walk into any setting knowing that you have the skill set and you have the education to be an effective healthcare professional.
Employers and clinicians benefit from students being practice ready to work as part of a team. And they already know how to do this in terms of the roles and responsibilities, in terms of the interprofessional communication. We have similar values, we have similar ethics, and that it's patient-centered care, that we're all focused on the patient. So employers don't have to spend time training new graduates how to do those things. They come into that practice ready.